My name is Leslie Bennett. I'm the National Organization for Rare Disease State Ambassador. I head up what we call the Connecticut Rare Action Network. That's an organization of, or an affiliation of patients, their families, healthcare providers, pharmaceutical companies, legislators, anybody who's interested in rare disease. And our purpose is to raise awareness of rare diseases and to work with the legislature on issues that affect patients within our state. A lot of our patients have problems getting access to services because people don't understand the disorders. We don't fit into any neat box. And it's been difficult, making people aware of that. We're right now, for the last 10 years, we've been working to get a Rare Disease Advisory Council to the Connecticut legislature. And the Connecticut legislature was so confused by this request that they developed a task force, and we're now in the process of having a task force. The task force will end in the middle of January. We have 4 more meetings, and what we're doing during that time period is exposing the legislature to different rare disease issues. And I think John Hopper will be talking at one of our meetings about rare cancers, for instance. And he will be talking about working with the mouse repository at Jackson Labs to develop a better understanding of his type of cancer. So these are the things that we've been doing, and it's because we need help. Our patients are faced by huge out-of-pocket costs for rare disease medications. Rare diseases there's 20% that are due to environment, and then the remaining 80% are due to genetics. And rare diseases do include a lot of rare cancers. With the exception of the major cancers, most of the cancers are rare. John represents fibrolamellar cancer, which is a cancer that affects teenagers and young adults. And so, it's been devastating. These patients don't live. My own daughter has a metabolic disorder. And what we work for is a lot of the metabolic disorders are now being picked up in newborn screening. Our state screens for 65. It started out 50 years ago screening for one disorder, PKU. We're now up to 65. And the projections are we'll be screening for 100 soon. So these are lives that we actually end up saving. There are therapies for each of these rare disorders that are there, and the difference between a child who has been treated from birth on and a child who hasn't is just dramatic. The children who are treated right from birth go on to lead fairly normal lives, other than the fact that they have to take a medication for the rest of their lives. The ones who are not treated end up like my daughter. They're wheelchair-bound, bed-bound by the time they're in their 20s, and they do last until they're into adulthood now. Pediatric medicine has improved so much that these children are living to adulthood, and it places a huge burden on the states and basically on our public health system. So these are the issues that we're facing.